As we come back here now to the KFYR Plus news desk, yesterday was National Women's Checkup Day, serving as a reminder for all women to make sure their health is where it should be. Checkup Day is part of the larger National Women's Health Week, which started on Mother's Day every year, and now the goal is to empower women of all ages to make their health a priority. Joining me right now to discuss this topic is Dr. Stephen Quay, who holds an MD and a PhD from the University of Michigan, was a faculty member in the pathology at Stanford. Dr. Quay, thank you for your time today. Sure appreciate it.
It's great to be here, Jay. Thank you for having me.
You got it. So, Dr. Quay, how can women take proactive steps to improve their breast health during this National Women's Health Week?
Yeah, so because it's National Women's Checkup Week and Day, I think we should broaden it from breast cancer. I mean, most important thing is to schedule a checkup, right? I
Mm-hmm.
mean, when your car needs an oil change, you're going to do it promptly if you're going to keep your engine running well. And women should schedule a checkup. Now, at that checkup, they should ask about their individualized risk factors. I did a little research in North Dakota, the top 5 serious illnesses for women. Heart disease, cancer, accidents, Alzheimer's, and stroke. So they should ask, are there particular risks for those individual events? They should also bring mental health, into the checkup room, because I think everyone is under a lot of financial stress, family stress, and there are treatments and ways to deal with that. And finally, if you're a woman, you could kind of lead by example, and for the other women in your life, get your checkup, do the proper things in that setting.
So, what inspired your focus, however, Doc, of research on breast cancer prevention?
Well, I think it's very simple. I mean, I could say Benjamin Franklin did it when he said a stitch in time saves nine. The
Mm-hmm.
concept of preventing breast cancer is much easier than treating it. Treating it, we do what you call cut, burn, and poison. So we have a surgeon and chemotherapy and radiation. And so if you can actually prevent it, and we think we probably can, we just did a study showing that women with a particular kind of mammogram, high density, can actually take a pill and reduce their risk of future breast cancer. So we're really excited about that.
What are some of the challenges that you faced in your research?
Well, I think that the challenge can be summarized in the fact that we have calendars of firefighters, but we don't have calendars of people that put in the smoke detectors. That's a euphemism for the fact that we really do focus on emergencies or treatment, or when things are happening rapidly,
Mm-hmm.
as opposed to actually taking the steps when nothing's going on to prevent a future condition.
What should women be asking when they go to their checkups that they usually don't ask?
So again, let's get back to it. So, despite my focus on breast cancer, the number one, cause of serious illness with women is heart disease, and number 5 is stroke. Both
Mm-hmm.
of those have to do with your blood vessels. So, high blood pressure, high cholesterol, high stress, all of those things would turn up in a blood test at a checkup. So you get the blood done, you get the work, you go into the doctor and you say, well, am I at risk of heart disease and stroke? Am I at risk of cancer? And am I at risk of Alzheimer's disease? And then you try to do preventive activities.
Has technology changed the landscape of breast cancer detection and treatment?
So it has a key role in the detection, I think, especially both of women at high risk who are in line to have prevention and diagnostic. So many of the machines that do mammograms have add-on software that actually acts as a avatar and assistant to tell the doctor, hey, look here in the breast, look here in the breast. And those things have been shown to greatly improve the accuracy of mammograms.
Dr. Quay, what do you see as the biggest challenges in breast cancer prevention today, and how can they be addressed?
Well, we are in the clinical stages of getting our drug approved, so it's not available yet. But once it is available, it'll be education, getting women and doctors to understand there is a way to prevent breast cancer, and then spreading the word, and then having women take the treatments, which we showed in our clinical trials have very few side effects. So if you're preventing a cancer disease, you want to have a drug that's much like a sugar pill, and that was the findings we had in our clinical trials.
Hmm. What are your predictions for the future of breast cancer research and treatment?
So if we are successful in getting FDA approval to prevent breast cancer with this drug, approximately half of the breast cancers will not occur, which means we go from 250,000 a year right now, one a minute literally, to about 120,000. That would be, significant contribution.
Dr. Quay, what final advice would you give to women who are concerned about breast health or in anything really on this National Women's Health Week?
Yeah, well, again, schedule a checkup, get in there, talk to your doctor, have a list, write down your questions, write down your answers because it's an
Hmm.
emotional situation with your doctor. You may not remember the answers. Excuse me. North Dakota has some wonderful programs. If you're financially stressed, you don't have insurance, let me tell you about one of them if I could. It's called Women's Way Program.
Hmm.
The number is 1-800-449-6636. And it gives free pap smears, free mammograms, and some advice in that area. So don't let insurance or financial situations prevent you from getting a checkup and then getting your friends to get a checkup. Ask the right questions in there. Take care of your mental health.
Dr. Stephen Quay, thank you so much. We appreciate the invaluable insight today.
Thanks, Jay.
Thank you. All right, it is now 10 in front of 2 o'clock. Quick break. We're back with more news next on KFYR Plus.